Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hello, I'm the weight loss champion, Chuck Carroll. Thanks so very much for watching and downloading in more than 150 countries around the world and making the Exam Room one of the most consumed nutrition podcasts anywhere on the planet today. And on this day, we are talking about a very common form of cancer, especially you look at this list. I'm going to read off some names here. Robert De Niro, Colin Powell, Arnold Palmer, Ben Stiller, Sidney Poitier. What do they all have in common? They all have had prostate cancer. But today, to talk about prevention and lowering your risk of developing it, is the one, the only Dr. Neal Barnard. Thanks for being here again.
Great to be here, Chuck.
You hear that name. I mean, that's a list of A-listers, and that's only 5. I mean, I could have gone on for days. These are just well-known individuals, but this is something that can really affect any guy out there.
It sure can. Now, when I was in medical school, we were taught everybody gets prostate cancer if you just live long enough to get it. Now, that's overstating it. It's not true. But the older you get, the more common it becomes. And for a great many men, they have some cancer cells in their prostate, not enough to affect their life, but they're there. So very common disease.
How preventable is this particular form of cancer?
I think it's highly preventable. I'm not going to say 100% preventable, but when I say highly preventable, what I mean is there are factors that we can control, and a lot of them have to do with what we put on our breakfast and lunch and dinner plates. All
right, let's talk about some of those factors. I think that, it's not uncommon for a guy to go into the doctor's office over that certain age. They give you the old checkaroo there and, might be told, well, you have an enlarged prostate. Is that the first sign that something could be amiss?
No, those are two different things. They just enlarged prostate. That's prostate hyperplasia. Those cells are there. But it's not a cancer cell. What defines a cancer cell is in the center of that cell, in the nucleus, is the DNA. The DNA is damaged, and now that cell can't stop multiplying. So 2 become 4, and 4 become 8, and 8 becomes 16, and then they invade locally, and little bits can break off and circulate in the blood and plant somewhere else. So that's different from just the gland growing in your body.
Gotcha. What are some of the more common lifestyle and dietary habits that we have that are driving us toward more cases of prostate cancer?
Back right around the year 2000, a study came out from Harvard University where they've been looking at health professionals for a long period of time. The health professionals follow-up study, and also another one called the Physicians' Health Study. In both cases, they got professionals, people who willingly participate in research studies. They write down everything they eat, and they tell you about their health journey. And what they found back in the late 1990s was the first inkling. For some reason, milk drinking men had substantially more prostate cancer than men who didn't drink milk. And we thought, what's that about? What could be the connection? Well, believe it, a couple of years later, the other Harvard cohort found the exact same thing. Both the health professional study and the physician's health study, they both found the same thing. Milk consuming men had a higher risk of prostate cancer. Now you might say, okay, well, they're drinking high-fat milk. Not the case, really. The physicians are health conscious. They're drinking low-fat milk, skim milk, and that was associated with prostate cancer as much as the high-fat milk.
Is it a protein in there that was really driving up the risk? Do we know?
We've got really 2 suspects. The first suspect is IGF-1. Insulin-like growth factor. There's a trace of it that the cow makes. It gets in the milk and you drink it. But the bigger issue is that when you consume milk, if I take a blood sample from you and then I feed you milk for a week, 2 weeks, 3 weeks, what you discover is that your IGF-1 level goes up because the milk causes your body to make more IGF-1. Now, insulin-like growth factor is a normal thing. It's the reason that kids grow. I mean, it's part of the growth process. But when you're fully grown, continued growth can mean the growth of a cancer cell. IGF-1 is a stimulant for cancer cell growth. So that's probably our biggest suspect right now, and I think it still makes sense. Once that was discovered, it really made sense of the data because it's not a question of the fat content of the milk. High-fat milk is bad for you for other reasons. It'll raise your cholesterol and so forth. But the IGF-1 is irrelevant. The fat is not the issue.
Would then the same risk be there if somebody were to consume dairy through cheese or other foods?
Yeah, very likely.
Okay.
Yes.
Interesting. All right. So we've got the dairy connection there. What are some other dietary things? If a person is overweight, eating that standard American diet, but maybe they're not big on dairy anyway, but they really do enjoy a good hamburger and fries once, twice, three, five, six, 7 times a week, then is their risk also going to be substantially higher?
Yes, it will be. And by the way, on the dairy thing, I didn't mean to suggest it was only those 2 studies.
Correct.
Since those classic Harvard studies, others have been looking at it, and the data are pretty consistent.
Okay.
Pretty consistent. But yes, okay, a typical meaty diet or overweight, both of those things independently do increase the risk.
Okay. What is it about obesity that would increase the risk? Is it just perhaps because the body then would be in a chronically inflamed state? Is there other factors?
I think that's as good a hypothesis as any. When you look at the relationship between obesity and cancer, it's not just 1 or 2 forms of cancer that are associated. A great many forms are, which leads us to speculate exactly along the lines that you have, that there's something systemic going on. So it could be an chronic inflammatory effect. It can also be hormonal. A fat cell is not just a bag of calories. A fat cell is a living metabolizing factory. And in a man's body, he makes testosterone. The testosterone in his bloodstream goes into his fat cells, and it comes out as estradiol.
Yeah.
There are enzymes in fat cells that generate female sex hormones out of male sex hormones. So we think, well, wouldn't that reduce the risk of getting prostate cancer if you're taking his testosterone away and giving him more estrogen? Doesn't seem to be the case. Estrogens seem to play a role as well.
Interesting. Let's go ahead and open up the doctor's mailbag. We have a lot of curious cats who are watching today. So Susan's like, well, listen, guys, you're talking about the foods that drive up that risk. What are the ones that can really considerably reduce a person's risk of developing prostate cancer?
Great question. Probably 30 years ago, people started noticing that men who ate more tomato products had less prostate cancer. And the attention then went to the reason why it's red. Tomatoes are red because of lycopene, Lycopene. Lycopene is a powerful antioxidant. It's a cousin of beta carotene, the orange antioxidant, but lycopene is in tomatoes. So researchers have put this to continued study, and they found that the more tomato products a man eats, the lower his risk of prostate cancer. Something like maybe 10 servings per week, about a 35% reduction. So it's big. Salsa counts. Ketchup counts. Yes, it does. You're looking for something redeeming about ketchup. We have found it. It's just the lycopene content. So the tomato products matter.
Interesting.
Oh, and by the way, anything that has lycopene in it is also associated with it. So in nature, you look at a watermelon, that's lycopene. But a strawberry gets its red from anthocyanins. That's not lycopene. So they're good for other reasons, but the lycopene is in pink grapefruit, watermelon, but especially the tomato products. In our culture, that is the big source.
I was just gonna ask you that. I wonder if there is a society out there, I think perhaps stereotypically so, like an Italian background, where you'd think lots of pasta, lots of tomatoes, lots of that. Do we know if the rates, the incident of prostate cancer would be lower in such a culture compared to here?
It is lower, provided you control for the confounders. So let's say you're in a pasta-loving family, but some of them are having it with the cream sauce,
right,
and others are having it with the marinara sauce. It goes along with the lycopene.
Gotcha.
And by the way, to answer Susan's question, there's another thing to brag about a little bit, and that's soy products. We've known for a long time that soy products reduce breast cancer risk. I should say that twice because people who are listening who have heard this.
Yeah, look right into that camera right over there.
It really is true. People have this urban myth will not die. This idea that soy causes breast cancer, it does not. Soy reduces the risk of breast cancer, and it reduces the risk of mortality in women previously diagnosed with breast cancer. Soy is a good thing. But this is about prostate cancer. Soy does about the same thing for prostate cancer. Men consuming the most soy have less risk of developing prostate cancer.
All right, but now I can hear the macho guys in the audience say, okay, well, less risk of prostate cancer developing that, but what about developing man boobs if I eat the soy?
Okay, soy does not cause man boobs, and you can prove this yourself.
Let's look in that camera again and say that one more time.
Okay, man. You can prove this yourself. Look, if you had thought that breast enhancement that a person may have experienced came from eating soy, you can disprove this any sunny afternoon. Go to the beach, and if you see kind of a heavyset guy who's got some breast enhancement, he's pulling off his shirt, and you see it. Okay, walk right up to him and say, "Excuse me, how much tofu have you eaten this past week?" And he'll say to you, "What are you talking about? I don't eat tofu. I eat chicken wings and pizza and just regular stuff." First of all, he's not eating soy. The reason he got man boobs is because he's eating high calorie, low fiber foods that caused him to gain weight. And when he gains weight, he's turning his testosterone in the fat cell into estradiol that's causing breast enhancement.
Gotcha.
And when he loses weight, that breast enhancement goes away.
You mentioned fiber just now. Does that play a role in terms of cancer prevention here, specifically prostate?
Well, fiber is known particularly for colorectal cancer prevention, but it prevents other kinds of cancer too, because when fiber goes down your digestive tract, it picks up excess hormones from your body and removes them as well. So your body takes those estrogens that your fat cells made, and some of it gets squirted from the liver into the digestive tract. Fiber picks it up, carries it away.
Ryan Sandberg was a very famous Chicago Cub baseball player. Just announced recently that he was diagnosed with a recurrence of prostate cancer. He said this time it was more invasive. It had already spread. If somebody were to make the dietary changes, start eating a lot of the foods that we've been talking about, after they have been diagnosed and gone through treatment, what do we know in terms of preventing a recurrence there?
There's every reason to make a diet change. And here I want to give some credit to Dean Ornish. Now, what he studied was people who had men who had prostate cancer. But it tended to be a relatively early stage, but we have every reason to believe that his findings would also relate to later stages. What he did, he brought in people, they had prostate cancer, randomly assigned to two groups. One group, just get the best medical care you can. Control group. The intervention group said, get the best medical care you can, but also let's go vegan. The kinds of things that Dean Ornish has talked about. Yeah. Let's exercise and so forth. Totally vegan diet. And along the way, everyone got a blood test. And what you're measuring is PSA, prostate-specific antigen. If it's rising, that means the cancer is advancing. So a year later, the people in the control group who hadn't done anything other than regular medical care, their PSAs did what PSA levels do in men with prostate cancer. They rose, on average, about 6%. Okay. In the other group, they didn't rise. In fact, they didn't even stay the same. They dropped a little bit, not a lot, but about 4%. In the control group, there were a couple of guys who had to drop out because their cancer was advancing. They had to have surgery or had radiation. In the intervention group, nobody needed to drop out. So will that still be the case 2 years, 5 years, 10 years, 15 years later? I don't know. And I would be surprised if everybody becomes bulletproof, but I would absolutely do all of those steps. So a completely plant-based diet, not a hint of the dairy products that are associated with causing it. And don't just bring on the lycopene, bring on all those colors of the rainbow and eat as healthfully as you can. Let's exercise. Let's do what we can, because the body wants to fight prostate cancer. Yeah. The prostate cancer can very often be conquered, I think, in many of these cases, or at least be arrested.
What kind of symptoms should somebody be looking for? Is this one of those cancers that can just develop over time, and for the most part, the person's clueless?
That's exactly it. Most men have no symptoms at all. What can happen, though, is that a man can have urinary stream is reduced, more dribbling, more hesitancy, more incomplete evacuation of the bladder, and the doctor can do an evaluation and can separate the prostate hyperplasia from prostate cancer.
Let's switch over. Talked a lot about food. Let's talk about green tea here. Sharon is wondering whether green tea might have a protective effect in this case.
Possibly. It's one of those things where there has been some signal of it, but it's been inconsistent, and it has not been proven to be the silver bullet, and B, it doesn't take the place of the changes that we've been talking about.
Let's see here. We've already talked about soy. We've talked about fiber. Sugar. James is wondering. James has a sweet tooth, Dr. Barnard. He's wondering whether his sugar-heavy diet might be contributing to his risk.
Yeah, if the sugar is coming in the form of ice cream, I don't think the sugar is causing it, but I think the dairy is.
Gotcha. Okay, goes back to that. So
yeah, no, I don't want to give sugar a pass all the time because what are you doing with sugar? Where's sugar from? You took sugar cane, which how much of that can you eat? I mean, not much. But you take the sugar cane to a factory, you throw away all that fiber, and you're getting this concentrated sugar that you could throw in anything. But I think the big problem with sugar is that manufacturers use it to make everything irresistible.
Mm-hmm.
I mean, that's the reason people eat ice cream. That's the reason people have a soda. That's the reason people have a donut. It's not the lard or whatever it is, the fryer grease that comes in. It's the sugar that lures you in. So sugar is this cultural Trojan horse that has a lot of bad stuff inside it.
Yeah. And I think it's really easy for somebody to get hooked on sugar too. I mean, it's just one of those things that your brain just seems to love for whatever reason. I think, the speculation, I'm not a doctor, have talked to a lot of people who say, well, this, dates back centuries and eons because of, the way that our bodies are designed to kind of store the calories because you never know when that next famine might be coming. And certainly sugary foods tend to be a little bit higher in calories.
Any animal of any species has to be able to differentiate something that's good for the animal, good for survival, and something that could be harmful. There are foods that go bad. So if a food is bad, what is it going to be? It's going to be sour. It's going to be bitter. And so our taste rejects those. I mean, we don't want that bitter taste. Something that's sweet is a fruit that's fresh, that's new, that's not diseased. And so these tastes are there to guide us in their own kind of rough way towards something that might actually be nutritious and good for us. So tree bark, not very sweet. I'm not going to choose that. An apple, oh, that's sweet. I'll choose that. The person who chose the tree bark died, and the person who ate the apples did better. So this is not by chance.
Yeah.
But things that are addictive, take those natural indicators, like sweet things are good, and technology drives them into, kind of puts them in hyperdrive.
Yeah.
So we find something that's sweeter than nature ever came up with. An apple is sweet. Blueberries are sweet. But pulling the sucrose out of sugarcane, that's sweet. and so that's what sells.
Yeah, man.
And so anyway,
yeah,
that's the problem.
I got you. All right. A couple more before we wrap things up. We were talking about lycopene, but Sharon is wondering what other vitamins and minerals have been known to be preventative in this aspect.
With regard, I have to say, I think lycopene is the big one, but why does lycopene work? It's an antioxidant. So I have found myself thinking in an area where we don't really have particularly good evidence that all antioxidants ought to be that way. So I'm talking about beta carotene. That's the orange in a carrot, in a sweet potato, in a cantaloupe, in a papaya, in a mango, or the anthocyanins, which are in lots of foods. They're in berries, in the blueberries, raspberries, blackberries, many, many, many foods. Why am I picking on these? Because how antioxidants work, number one, is they're circulating in your blood. They find a free radical that is just about to take a chunk out of your DNA, and they neutralize it. They knock it out.
Yeah.
So why should lycopene be unique in that respect? That's what antioxidants do. They ought to work that way. But the lycopene is the one that gets the credit. But I'm going to guess that if you eat for color, that you're going to see benefit from the others as well.
All right. Final question. The honor goes to Mark today. When people think about red and processed meat, a lot of time they think about colorectal cancer, not necessarily prostate cancer, but Mark is curious whether or not there's still a correlation between the two.
There is a correlation between the two, but it may be accidental. And what I mean by that is if you look at men with prostate cancer, they do tend to be men who have eaten a lot of these other foods. The dairy that is probably a big driver goes along with it. The cheese on the cheeseburger does that as well. And to tell you the truth, Chuck, most men with prostate cancer don't necessarily die of it. They often die with it because the heart attack that came from these bad foods is what killed them first.
There you go. Well, Dr. Barnard, I appreciate your time today. Can't wrap things up as always, though. Whenever you're on the show, I need to say a special thank you to the Gregory J. Ryder Memorial Fund for powering us and having us do this conversation today. We could not do it without their support.
I have to say, Allison Mahoney has been just wonderful in carrying Greg's memory forward in such a beautiful way.
Absolutely. And you can check them out online at their website, Gregory J. Ryder Memorial Fund. That's GregoryRyderFund.org. Gregory Ryder spelled REITER fund.org. And Dr. Barnard, thank you for your time, my friend.
Thank you, Chuck.